And I rise in support of this much-needed legislation that would expand housing options for individuals who are transitioning out of addiction treatment and required continued support. Now, these are typically people who have exhausted all of their resources already. Why? Because they're addicted. That's why they are in this. That's why they qualify for these housing assistance vouchers. And this is right on target for helping them. So the Thrive Act is an important piece of legislation with strong bipartisan support that came out of our committee that would create a pilot program to allocate Section 8 housing choice vouchers to transitional housing nonprofits with evidence-based models of recovery and life skills training. It's important to note that this is 10,000 total vouchers out of the 2.2 million that are available, or 0.5% of all of those vouchers, whichever is less. So we're talking about a portion, a small portion of all the total vouchers that are available. But here's what we do know, Mr. Chairman. Our country, our states, our communities are in crisis right now. Over the last decade, there's been this dramatic rise in opioid abuse, whether it's the non-medical use of prescription drugs as well as illicitly manufactured heroin. We need engagement at every level. In light of this medical emergency, there's an extremely pressing need for additional transitional housing for opioid recovery. These housing programs must follow a proven evidence-based approach that has helped thousands of Americans to maintain sobriety after completing rehab, gain these valuable job skills, obtain employment, and eventually transition back into society to lead independent lives. Time and time again, individuals who have just completed inpatient rehab programs are forced to live in housing situations where they're surrounded by the people that are using the same illegal substances that sent them into rehab. We have to change that. And while evidence suggests that the effective treatment and recovery plans should cover a span of 3 to 5 years for an individual based on their needs and severity, we have a long way to go to properly prioritize and fund the recovery support programs and resources that individuals need in their communities. 23 million Americans are in recovery today. Let me repeat that. 23 million people are in recovery today for substance abuse. A sober, safe, and healthy living environment that promotes recovery from substance abuse is essential in providing quality recovery support. These are people who qualify, as I had said before, for these Section 8 vouchers, and because they've exhausted their resources, let's throw them a lifeline. Let's throw them some help. Let's allow them to have an opportunity to go and succeed. So that's why I strongly support the Thrive Act, which also has the support of the Michigan Heroin and Opiate Prevention Education Program, which is known as My Hope. And I urge all my colleagues to support this bill, and I yield back the balance of my time.